Have you ever noticed how your legs feel heavier right at the end of the day? Like something is pulling you down while you try to relax on the couch. And at night, when you finally lie down, that uncomfortable sensation in your feet comes, as if they were freezing even under the covers. This is not ordinary tiredness. And it's not normal. It's your body screaming that something critical is failing exactly when you need it most, before going to sleep. If you've ever woken up in the middle of the night with a violent cramp in your calf, if you feel constant tingling in your legs, or if you notice that walking short distances is getting harder and harder, pay attention. These signs are not just discomfort. They are direct warnings that blood flow in your legs is compromised. And when this happens, the risks go far beyond pain and discomfort. We're talking about progressive loss of mobility, a threefold increase in the risk of serious falls, and deterioration in quality of life that many people accept as normal, but which shouldn't be. And before the end of this video, you'll discover exactly which signs cannot be ignored, and a simple protocol you can start today, without expensive equipment, without drastic changes in your routine, just with something you can drink before bed that has the proven power to restore your circulation in a matter of days. I'm not talking about empty promises. I'm talking about applied science, about studies published in respected medical journals, about results you can measure and feel. My name is Klaus Hoffman, and here at Senior Health I bring practical, direct, and evidence-based information to improve your health in a real and sustainable way. If you haven't subscribed to the channel yet, do it now and turn on the notification bell so you don't miss any content that can make a difference in your life. Now, let's understand what's really happening inside your body. What's causing that heavy leg sensation, those night cramps that pull you out of sleep, that growing difficulty doing simple things like climbing stairs or walking to the corner? The central problem has a name: nitric oxide deficiency. And this substance, which many people have never heard of, is absolutely essential for your circulation. Nitric oxide is produced naturally by the inner lining of your arteries, and its main function is to make blood vessels relax and open up. Imagine a garden hose. If it's bent or clogged, water doesn't flow properly. That's exactly what happens to your arteries when nitric oxide is lacking. They stay constricted, narrow, rigid, and blood simply can't circulate as it should. And here's the critical point. After age 60, nitric oxide production can drop up to 70%. This is not a gradual and imperceptible decline. It's an abrupt drop that has direct and immediate consequences on your vascular health. When there's this deficiency, blood doesn't reach the muscles, nerves, and leg tissues adequately. The oxygen and nutrients that should be feeding these structures don't arrive. And the result is devastating: heavy legs, chronic pain, frequent night cramps, numbness, tingling, constantly cold feet, drastic reduction in walking endurance, and a 3 times higher risk of falls that can result in serious fractures. But here's what most people don't know, and what healthcare professionals don't always explain. There are specific foods and drinks that your body can convert directly into nitric oxide. And some of them are so powerful, so effective, that they can increase blood flow in the legs between 40% and 60% in just one day. It's not magic. It's not exaggeration. It's pure biochemistry. And it's proven by hundreds of clinical studies conducted at universities around the world. The secret lies in compounds called dietary nitrates. When you consume foods rich in these nitrates, your body initiates a fascinating process. The natural bacteria in your mouth convert these nitrates into nitrites. These nitrites are then absorbed and transformed into nitric oxide. And when nitric oxide reaches the walls of your arteries, they relax, open up, and blood flow increases in a measurable and significant way. But attention, not all drinks work the same way. Some have effects that are too weak to make a real difference. Others have side effects that can negate the benefits. And one of them, specifically, stands out as the most effective, fastest, and safest of all. But before revealing which one is this champion drink, you need to understand the signs your body is sending right now, because they are the key to knowing if you need to act immediately. First sign: heavy legs at the end of the day. If you feel like your legs are carrying extra weight after a few hours standing or walking, if it feels like someone tied sandbags to your ankles, this is not normal muscle fatigue. It's lack of oxygen in the tissues. Blood is not getting there as it should, and your muscles are literally suffocating. They're working in emergency mode, without adequate fuel, and the result is that sensation of weight, of deep tiredness that doesn't go away even after you sit down and rest. Second sign: frequent night cramps. If you wake up in the middle of the night with that sharp and unbearable pain in your calf, that sensation that the muscle has locked up completely and you can't move your leg, this is much more than a passing nuisance. It's a red alert from your body. Night cramps are a direct result of poor circulation. The muscle is not receiving the necessary nutrients and oxygen during the day, and at night, when you're lying down and circulation becomes even slower, it goes into spasm. It's a situation of cellular desperation. Third sign, constant tingling and numbness. That sensation of pins and needles, that your leg has fallen asleep for no apparent reason, that there are little ants walking under your skin, is a sign that the nerves are not receiving adequate blood. Nerves are extremely sensitive structures and need constant blood flow to function. When this doesn't happen, they start sending warning signals. And when tingling and numbness become frequent, the risk of permanent nerve damage increases exponentially. Fourth sign, constantly cold feet. If your feet are freezing even in heated environments, even wearing thick socks, even under blankets, it means blood is not reaching the extremities of your body. The extremities are always the first to suffer when there are circulatory problems, because they are the points furthest from the heart. It's one of the clearest and most concerning signs of poor circulation, and should not be ignored. Fifth sign, progressive difficulty walking. If you notice you're losing endurance week after week, that you need to stop to rest more often during a short walk, or that climbing a flight of stairs has become an almost impossible challenge, this is not just a natural consequence of aging. It's the body calling for help, asking for more oxygen, more blood flow, more nutrients for the muscles that are trying to work in precarious conditions. If you recognized at least 2 of these signs in your life, know that the risk exists and is real. But also know that it can be significantly reduced. And the good news, the really encouraging news, is you don't need expensive treatments, invasive procedures, or complicated changes in your routine. You just need to know what really works, what science has already proven, and apply it consistently. Now I'm going to reveal the 10 most used and most studied drinks to improve leg circulation, starting from the least effective to number 1, which is the one you should prioritize if you want fast and sustainable results. And at the end, I'm going to reveal a surprise method that can triple the effects when combined with the right drink. Drink number 10, water. Yes, pure and simple water. It is absolutely essential for vascular health. When you're dehydrated, your blood becomes thicker, more viscous, and this makes it difficult for blood to flow through the vessels. Drinking water adequately keeps blood fluid and facilitates circulation. But the real and measurable increase in circulation is only 8. Long-term studies have shown that daily consumption of pomegranate juice can reduce arterial plaques by up to 30% in 1 year. But here we also have the sugar problem, even higher than cherry, with 32 grams per glass. And the cost is prohibitive for prolonged daily use. Drink number 6, pure cocoa drink. Rich in flavonols, especially epicatechin, this drink increases blood flow by approximately 24% within up to 2 hours after consumption. Cocoa flavonols stimulate nitric oxide production and improve endothelial function. But critical attention here, it needs to be pure cocoa, without sugar, without condensed milk, without processed chocolate. Pure cocoa powder, mixed with hot water, can be sweetened with stevia if necessary. It's effective and has a relatively quick response, but not as potent as the next ones on the list. Drink number 5, watermelon juice. This is a significant jump in effectiveness. Watermelon is a natural source of L-citrulline, an amino acid that the body converts into L-arginine, which in turn is converted into nitric oxide. Improves arterial function by 28% and has the additional benefit of reducing blood pressure. Many people report feeling warmer feet, with better circulation, a few hours after consuming watermelon juice. The only real problem here is seasonal availability. Fresh watermelon is not available year-round in many places, which makes consistency difficult. Drink number 4, hibiscus tea. This vibrant red tea is surprisingly powerful. It improves endothelial function, which is the inner lining of the arteries, and reduces blood pressure by up to 11 points in hypertensive people. Increases blood flow by 31% after 6 weeks of consistent use, and some people report noticeable improvement in as little as 10 days. Can be consumed hot or cold. But be careful, if you already take blood pressure medications, hibiscus can potentiate the effect and lower blood pressure too much. Consult a doctor before using it regularly. Drink number 3, celery juice. Now we're getting to the champions. Celery has very high natural nitrate content, and here's the magic. The conversion of these nitrates into nitric oxide begins right in the mouth, by saliva bacteria. The process is fast and efficient. Increases blood flow by 35 to 40% in just 3 hours after consumption. Should be consumed fresh, preferably on an empty stomach, for maximum absorption. The only real problem is the taste, which many people find difficult to tolerate. But if you can overcome that, the results are impressive. Drink number 2, arugula smoothie. Arugula is one of the largest natural sources of dietary nitrates available, with up to 480 milligrams of nitrates per 100 gram serving. When you make a smoothie with fresh arugula, water, and maybe a little lemon to improve the taste, you're consuming a concentrated dose of nitric oxide precursors. The effects are quick, improvement in cramps in a few days, increased walking endurance in 1 week. The problem is it requires frequent preparation, and arugula needs to be fresh to maintain nitrate content. But if you can incorporate this into your routine, the benefits outweigh the effort. And now, drink number 1, the absolute champion, the most studied, the most effective, the one you should prioritize if you want real results: beetroot juice. This is simply the best source of dietary nitrates in liquid form available. Beetroot contains very high concentrations of natural nitrates that are quickly converted into nitric oxide in the body. Increases blood flow in the legs between 30% and 50% in just 2 to 3 hours after consumption. And the studies on beetroot juice are extensive and impressive. A study published in the Journal of Applied Physiology, one of the most respected scientific journals in the field, showed results that changed the way the medical community looks at dietary interventions in circulation. Participants who consumed beetroot juice daily for 2 weeks showed 45% improvement in leg blood flow, 38% reduction in arterial stiffness, and 22% increase in walking endurance. These are not marginal numbers. These are clinically significant improvements that directly impact quality of life. The results are fast and sustained. You can feel a difference in the first 24 hours with warmer and less heavy legs. In 3 days, the sensation of weight decreases visibly. In 1 week, night cramps reduce drastically or disappear. In 2 weeks, you notice you can walk farther, climb stairs with less effort. And in 1 month, circulation is visibly better. There's a side effect that scares some people: pink urine. This is called beeturia and happens in about 10 to 15% of people who consume beetroot. It's completely harmless. It's just the beetroot pigment being eliminated. It's not blood, it's not an infection, it's nothing to worry about. The only real caution is for those with a history of kidney stones, because beetroot contains oxalates, which in excess can contribute to kidney stone formation. If you have this history, consult a doctor before using regularly. Now, how to apply all this practically, in a way that you can start today and see real results. Here's the complete and detailed protocol. Step 1. Every morning, on an empty stomach, drink 240 milliliters of pure beetroot juice. It doesn't need to be freshly made. You can buy pure bottled beetroot juice, but it needs to be pure, without added sugar, without excessive preservatives. Fasting is important because it maximizes nitrate absorption. Drink it as soon as you wake up, wait 30 minutes, and then have your breakfast normally. Step 2. In the afternoon, between 3 and 4 p.m., take a second support dose. It can be hibiscus tea, which is easy to prepare and has an excellent cost-benefit ratio, or celery juice, if you can tolerate the taste. This second dose keeps nitric oxide levels elevated throughout the day and potentiates the effects of the morning dose. Step 3. 3 to 4 times a week, add an arugula smoothie as a complement. It can be as an afternoon snack or mid-morning. The timing is not as critical as with the beetroot dose. Use a handful of fresh arugula, water, juice of half a lemon, and blend in the blender. Drink immediately. Follow this protocol with consistency. Don't skip days. Don't use sporadically expecting results. Restoring vascular function requires constancy. But when you do it right, the results appear in a predictable and measurable way. But there are critical mistakes that can completely nullify all the benefits, and you need to be aware of them. Mistake number 1, consuming these drinks along with heavy meals, especially rich in fat. Fat interferes with nitrate absorption. Always take at least 30 minutes before or 2 hours after meals. Mistake number 2, using mouthwash right after drinking nitrate-rich beverages. Mouthwash kills the beneficial mouth bacteria that do the initial conversion of nitrates into nitrites. Without these bacteria, the process doesn't work. If you use mouthwash, use it before drinking the juice, never after. Mistake number 3, expecting permanent results in a few days and then stopping. The improvement is quick, yes, but maintenance requires continuous use. If you stop, nitric oxide levels drop again and symptoms return. Mistake number 4, abandoning prescribed medications because you're feeling better. Never, under any circumstances, stop medications without medical guidance. This protocol is complementary, it doesn't replace medical treatment. Mistake number 5, consuming industrialized versions full of sugar thinking it will have the same effect. It won't. Excess sugar causes inflammation and can even worsen circulation. Always use pure versions. And now I'm going to reveal the surprise factor, the additional method that can triple the protocol's results. If you combine beetroot juice consumption with controlled cold exposure on your legs, nitric oxide production can increase by up to 70%. This is not speculation, it's based on studies about thermogenesis and vascular response to cold. Here's the exact protocol. After drinking beetroot juice in the morning, wait about an hour. Then, expose your legs to cold water. The ideal temperature is between 15 and 20 degrees Celsius. You can do this in the bathtub, in a large basin, or even in the shower directing cold water only to your legs. Immerse your legs up to the knees for exactly 3 minutes. No more than that, because excessive exposure can be counterproductive. Do this 3 times a week, not every day. What happens is fascinating. The combination of nitrates circulating in the blood plus the body's response to cold activates a defense mechanism that triggers nitric oxide production explosively. The body tries to protect the extremities from the cold by increasing blood flow, and since there are nitrates available, nitric oxide production shoots up. It's pure synergy. This is not theory. It's not guesswork. It's applied science. And it works in a reproducible and predictable way. Now I want to hear from you. Which of these signs have you already felt? Do you wake up with cramps in the middle of the night? Do you feel your legs heavy at the end of the day? Do you have difficulty walking distances that used to be easy? Comment down below and also tell me where you're watching from. Let's create a community of people who are taking control of their own health with quality information. And if you know someone who needs to hear this, someone who is suffering from poor circulation and accepting this as normal, share this video now. You could be changing someone's life. If this content was useful to you, if you learned something new and applicable, leave your like down below. Subscribe to the Senior Health channel and turn on notifications to receive more practical, direct, and evidence-based information to improve your health in a real and sustainable way. We're here to help you live better, with more mobility, more independence, and more quality of life.